We are back. Welcome to a new season of Watch Your Mouth, the podcast series brought to you by the Ministry of Health and Wellness's Oral Health Unit, where we uncover the secrets behind your smile. I'm your host, Dr. Chanel Dempster-Peart, and today, for our season opener, we have a very special episode lined up. We're honored to welcome Dr. Christopher Tufton, Jamaica's Minister of Health and Wellness, to join us as we explore the vital intersection of policy and public oral health. In today's conversation, we'll dive into the current state of oral health in Jamaica, discuss the government's efforts to improve dental care, and explore how strategic policies are shaping the future of our nation's smiles. So sit back and join us as we engage with Dr. Tufton on oral health in the big health picture for all Jamaicans. Minister Tufton, thank you for being here. Could you start by giving us an overview of the big picture of oral health in Jamaica at this time?
Thank you very much for having me, and I thank the viewers for tuning in to this very important subject matter. Oral health in Jamaica is an underserved market. Even though we have over 70 dental units, oral health units within the public space and many in the private space, unfortunately there is a view that you brush your teeth, and to the extent that you have a toothache, you go to the dentist and you extract. And so everything in between that sometimes requires a lot more education and a lot more persuasion. And of course, there's an economic component to it. So from a policy standpoint, the big picture is to get more Jamaicans to recognize the importance of oral health, of taking care of their mouth generally, and to make the connection between good oral health and generally good health. And so there is a communications component to enhance the knowledge and the acceptability of good health. And there's an execution component which yourself is involved in, and others, Dr. McKenzie, who heads up the unit, which means having more oral health units, having them equipped to do more than just extraction, and to promote good oral health, both at that location, but also in our schools and in the wider society. So that's the general picture of what we hope to achieve, and we've been doing some special programs for that.
Do you have any successes that you've seen so far?
Well, I think that the team over the last number of years have done more at the level of our youngsters in the schools to promote good oral health hygiene. And we have done so in collaboration with partners in terms of supporting that, Colgate as a brand being a big partner, but there are many NGOs, non-government organizations, some local, some abroad, who have come in and partnered with us, and that's a very positive thing. So I think there's greater knowledge. The other one that you and I know, a kind of flagship program, is the Second Chance Smiles,
Yes.
which you have been very big on. And Second Chance Smiles is really, as it says, giving someone a second chance to smile, showing their perfect look.
Yes.
In terms of their teeth. And this is to correct persons who have lost their permanent teeth or tooth, as the case may be. And the demand for that, as you know, is quite high.
Oh, yes.
A lot of people want to be a part of that, but it also shows the problem. Too many of us extract as a first option.
Yes.
And we have seen many people come, benefited from it, and as you know, we have a long line of others who are coming on board. So what we use Second Chance Smiles to do is not just to correct a particular problem of an individual, but to educate the population, their relatives, their families, their friends, that extraction is not the first resort. You can do a lot of other things, starting with prevention by practicing good oral health.
And if it is we have to extract, then certainly we need to ensure that we make some steps towards replacing these teeth. So, Minister, with challenges like those and like limited access and disparities in care, what initiatives are currently in place to ensure that even the underserved communities will receive this quality care?
Okay, so one of the things that we're looking at, the Second Chance Smiles is a big initiative, a big play, and I think we're going to have to expand that. And part of that initiative is to go into communities and encourage persons in the most rural parts to be a part of this program. And there's a lot of excitement around it, as you know. We have twinned that program with our Know Your Numbers, which is part of the screening program that goes into communities. So in a sense, the big push right now is how do you promote the mobility of service provision. So instead of people coming to a fixed station, we go to them in their natural space. I think that's the future. We're going to have to do more of that. Persons like yourself and others have made yourselves available to be out there, which is a very positive thing. And as a result, you're seeing more people and being able to treat more people. So I think the future requires things like mobile dental units, so the trucks or buses that go out. It requires greater partnership with faith-based communities like the church, the community-based organizations, and twinning with programs that already has an audience so we can get into those communities. The other part is to assess, given population change, where we need to establish more oral health clinics in the primary health institutions, in the health centers. We have added a few. I think we need to add more. And of course, that comes with more personnel. So we have to try to ensure that we get more people on board. The establishment has been changed recently through compensation review. So we're actually now able to hire more people. So I think we're in a better position today than we were 5 years ago. And it's just a matter of how we execute.
You have really hit the nail on the head about how collaboration is going to help move us forward. Another thing that's going to move us forward is technology, and I know you're a fan of technology. So what role do you see innovative technologies and modern treatment playing in the future of public oral health care in Jamaica?
Well, you know the technology far more than I, but there are ways, for example, I mean, again, coming back to Second Chance Smiles, to building dentures. And we have asked Dr. Mackenzie through his team, and including yourself, to put in the proposals to get the, what do you call that, 3D machines, so we can do more production. Depending on the mobile unit, you could make it more sophisticated in doing more services. The partnership even with the private space for very complicated procedures, because we do have in the private sector a lot of very advanced procedures around, you know, whether it's root canal or other more sophisticated and technical service provisions. So to the extent that we can partner, there's some of that that's taking place. So we are embracing technology. It's in keeping with our digitization of our patient records. So one patient, one record, and the record follows you wherever you go. And so that will give a doctor or a dentist, who's a doctor of course, an opportunity to see the history of the patient. So any assessment that is done, as you know, NCDs can affect and is affected your oral health. And so
and
if
the
you're
other direction as well.
exactly, so you know, whether you're diabetic or you're hypertensive, those things have to be factored into treatment. If you have One Health and a patient comes to you, if you have the history of that patient, you can determine how you treat with that patient. So all of that is coming together nicely. That will, with promotion, I think will go a far way in improving the scene, and hopefully Jamaicans will benefit.
Minister, you've made some progress, but have there been any challenges you've faced in implementing and updating oral health policies in particular that you'd like to share?
Well, the challenge is always the resistance to change, and that happens sometimes at the level of the operational side, as it does at the level of the patient. Culture is hard to change, and there is a culture around how you treat with oral health, how you treat with your mouth. You know, Jamaicans are proud people, hardworking people, but we place emphasis on different things. And as I said, extracting as opposed to filling, ensuring that you do annual checkup It's a real challenge. People don't go to the doctor unless they're sick.
Something is wrong.
They don't go to the dentist unless they have a toothache. So those are things that we have to change through education, through practice, through demonstration, which is why the outreach is important. You know, I think your fraternity in the public space have done well in embracing some of the changes, because I know it means more work. You have to go out more, you have to see more people, you have to work longer hours, and that's a good thing. And going out into schools and communities, that takes a lot. So we have to try and make it more comfortable for people like yourself to do that, and the supporting cast to give that support. And then, of course, getting the public to buy into what is important, which I think a program like this will help. So we don't look at problems, we look at challenges, and we plan to overcome them.
Exactly, exactly. Finally, Minister, what message would you like to send to the public and tell them about the importance of maintaining oral health and, I mean, the government's commitment to ensuring that it's accessible?
Well, I tell you something, I break it down in very simple terms. If you want your wife or husband or girlfriend or boyfriend to like you, when you smile, make sure the teeth are white and pretty. If you want the employer to give you the best possible option of employment, when you smile, the teeth them must look nice and pretty. Am I wrong or right?
You are absolutely
And if you don't have
right.
a girlfriend or boyfriend, you might just get one. If when you smile, the teeth them look white and pretty. Sounds like a cliche and a very parochial approach. But the reality is that your mouth, separate and apart from the biological implications or clinical implications of poor oral health, because it does affect your internals. I mean, your capacity to chew your food, for example. If you don't chew your food, your digestive system don't function properly, and that leads to all sorts of issues. So let's deal with that as a requirement. But beyond that, your mouth and your look and feel of your mouth in terms of your teeth and its presentation and so on is a great economic and social empowering tool. You get the point? To the extent that you take care of it, it will take care of you. So my advice to people is, you know, as you would when you're going out and you dress up to look at your Sunday best, when you're going to church or you're going to the dance or wherever, do the same with the teeth, right?
Love that message.
Basic but powerful, I think.
I agree.
Yeah.
So here on Watch Your Mouth, everyone leaves with a last lick, a parting word. What's yours?
Well, if you say last lick, while you're licking, make sure the teeth are smiling and shining. How is that?
Well, make sure that the teeth are able to enhance your self-esteem, your confidence, you're able to chew properly, you're able to digest your food well, enjoy the taste, certainly. And as you said, you're able to make sure that the mouth is licking.
A smile is not something to undervalue. A beautiful smile is powerful. So smile would be my word, my other word, apart from licking.
Two last licks. You must be the first to give us to start season 2. We'll take it. Well, that wraps today's episode of Watch Your Mouth. A heartfelt thank you to Minister Tufton for joining us and sharing his valuable insights into Jamaica's oral health policies and the innovative strategies shaping the future of public dental care. Thank you for joining us and helping us shed light on these critical issues, Minister. And thank you for tuning in. Until next time, keep smiling and watch your mouth.